Hey James,
Hi, Dr. Paul.
what's the crack? We're going to do a little chat about what it means to be a patient in Slimbr Health and talk about what patients can expect. Both of us spend all day talking to patients about weight loss and explaining how the Slimbr program works. So
We've started a few months ago offering, doctor-led access to GLP-1 medications, and we're seeing huge success from our client base. The combined weight loss now for our patients is well over half a ton. It really is a game changer for many of our patients. Some of them have been, bedbound or having issues with joints and things like that. The weight loss has been significant for them, and in some cases, double digits. So it's been life changing for them. And I think for most people, what they really want is not just to be issued with a prescription and off they go, but it's the regular contact is essential. And that combined with our, calorie monitored approach through slimbr.com is where I think that most people are seeing the success. They know that we're holding their hand, through the steps and giving them the support that they need, that they're not just left on their own. Dr. Paul, maybe if you could tell us a little bit about typically who this program is aimed at and what the eligibility criteria need to be to partake in this.
Okay, so weight loss injections are a revolution. Everyone's heard about them, everyone's talking about them. And eligibility, the rules are that you need to be obese, which means a BMI of over 30, or you need to be a BMI of over 27. Over 30 means obese. Over 27 is overweight. Anything over 25 is overweight. But generally the rules are if you're over 27 BMI, you need to have an additional condition. Now these are the official licensing rules for who can get the medication. These tend to apply to governments or when you're getting it on the HSC or various things. And now Mounjaro is not available on the HSC. Medications like Ozempic are only there at the moment. That's going to change in the future. But unlicensed means if a doctor wants to give a medication, that's within the confines of what it's officially licensed for. That said, a lot of medications can be used off license. They can be used outside the official licensed indication. So that means you can use them when someone's BMI is slightly lower or if someone doesn't have a medical condition. But it all comes down to the discretion of the doctor because that doctor takes responsibility for whether someone can get it at a different point when they don't fit the exact licensing criteria.
Typically, what medications do you prescribe? Is there one that you go to as a medication of choice? What do you recommend?
Yeah, well, I would say about 99% of our patients are on Mounjaro. It's the newest of the GLP-1 medications, and it has two different hormones in it, and it also acts in several different ways on how the gut works and how our satiety, our hunger levels are controlled. And with older generation GLP-1s, the single hormone would lead people to be more likely to have side effects. With the newer one, like Mounjaro and there are other ones coming down the pipeline, side effects are less of an issue just because it's kind of attacking the problem from multiple different ways, multiple different angles, which means there's a reduced risk of side effects with it. So for the side effect profile, I tend to choose Mounjaro for most of my patients. That said, there are a handful of people who want to choose products like Wegovy or even Ozempic, which although we may, consider slightly inferior products, they work very well. They're cheaper, but they do have a slightly higher side effect profile. And we're talking about Mounjaro, less than 5% of people would have a side effect, and that would generally be mild, whereas with some of the other products, it can be a little bit more like 6, 7, 10%. So it's still small numbers.
What makes Slimbr different to other service providers? How do we make sure you get the best results for our patients?
Weight loss management takes a little bit of time. It takes a little bit of expertise and understanding obesity medicine. So from the general practice perspective, a lot of people will get a script from their GP and kind of go off and do their own thing for 6 months. And as a result, they either will have results that don't last or they won't get results. And what can often happen is people will think that the medications do all the hard work. They somehow burn fat. All the medications do is they control hunger. So it's still in the remit of the patient themselves to understand and control calorie counts and control weight loss by reducing the number of calories. I always say to patients that their department is calorie control and therefore weight loss. My department is medication and therefore hunger control. With Slimbr Health, what we do is we don't just give you medication and leave you off for 6 months. We give you a prescription for the first couple of weeks, 4 weeks. Towards the end of that period, we allow you to track in the app exactly what your weight is on a regular basis, your calorie count. We give recommendations on that. We have dietitians who will chat with you and discuss exactly how you're going to manage to get those calories down. And we find a number of calories that will lose weight at a safe pace, so you're not losing it too quickly. And on a monthly basis, we'll check in with people, see, number one, are they feeling well? Number two, are they losing weight? Do we need to adjust the calories? And then the hunger side of things that is in the remit of the medication and the doctor's side to adjust We adjust that to make sure that although you're taking less calories than what your body needs, your body isn't going to be screaming out, giving you cravings, making you feel very hungry. You'll be able to manage it and feel like you're not dieting, even though you're consistently losing weight. We find a number of calories that will lose weight at a safe pace, so you're not losing it too quickly, which means that you'll manage to keep it off, which means that you won't suffer with problems like, hair loss or teeth weakness. Lots of problems can happen when you're being malnourished. And doing this over a longer term, rather than doing it over 2 months or 3 months, doing it over a longer term, like 2 to 3 kilos per month, means that you form the habits with the support of our team that allow you to just change the way that you eat, the way you think of food, and internalize the calories that come with each meal. So when you look at a meal, we all hate counting calories, but when you look at a meal, you'll just know, you'll have internalized how many calories are in a meal, and you'll say, oh, right, actually, from counting that during my Slimbr days, I know how much calories that is, and actually this would be a better portion size, or this will be a better choice. So we kind of adjust behaviors and help people lose weight for the long haul,
Exactly. And the development of those good habits will carry people forward from beyond their Slimbr. Exactly. How do people typically get started?
So the person will need to go through a questionnaire on slimbr.com, slimbr.com. From there, they can fill in an initial questionnaire to see if they're suitable. They'll get a call back from a member of the team, one of our specialists, who will go through the first steps and see if they're a match. After that, you need to do a call with the doctor to go through your medical history to make sure that there's nothing that we've missed, make sure that it's safe to go ahead on the medications. And then from there, you can then start. Maybe you want to tell people a little bit about Slimbr Health's partnerships with pharmacies in the north.
Absolutely, Paul. Yeah, so we partner with 2 pharmacies in Northern Ireland as we feel their price is more competitive than in the Republic. So this is purely just about passing on a cost saving that we've negotiated with these pharmacies to our clients and able to represent the best value that we can. And we can also arrange for the pharmacies to deliver those medications directly to your door for convenience. And we've negotiated for the 2.5 milligram, for example, that the price is £145 sterling, which is about €165. So that could be a saving of up to €100 per pen per month over pharmacies in the Republic. We only use pharmacies that are regulated by the Pharmaceutical Society of Northern Ireland.
Now, you will see stories of people who lose weight very, very quickly. In the Daily Mail, on one page, you'll see, I lost 10 kilos in 1 month or whatever it is. And then on the next page, you'll see, I ended up in intensive care because of Ozempic, Mounjaro, whichever medication. I don't believe that that's down to the medications. Although medications can cause side effects, I think the vast majority of people that experience problems with these medications, it's due to the pace at which they try to lose weight. And if you're losing weight extremely quickly, as a lot of these cases we see in the tabloids are, you're putting your body under a huge amount of strain, and you're effectively starving yourself. You're going into starvation mode. And as we all know, you don't need to be a doctor to know that starvation is not healthy. Your body needs certain nutrients. You need a lot of proteins, a lot of vitamins, a lot of minerals just for your basic functions. And skipping out on that, losing weight extremely quickly is going to result in malnutrition and serious problems. People joke, that they're far away from malnutrition when they're overweight. But actually, surprisingly, you can become malnourished very quickly by not getting all the right nutrients. So when you're taking in less calories than what your body needs, it's even more important than usual that what you're taking in is very healthy.
How quickly can patients see results, and what can they expect?
Depending on someone's weight level and whether they're overweight or obese will dictate how long it's going to take. The pace at which people lose weight, a lot of studies have shown that typically within a 6-month period, people can lose 12 to 14 kilos. And that's kind of pretty aggressive. It's a lot to lose, but that's at a sustainable pace of about half a kilo per week. We don't recommend more than that. That's £1 a week. If someone has a lot of weight to lose, it can be quite daunting to say that it might take 1.5 years or 2 years to lose all that weight. So we like to focus on 6-month chunks. For most people, they will get very close or make a big stride towards where they want to be in a 6-month period. So I think that's about a better way to look at it, rather than aiming to lose as much as possible, as quickly as possible.
Slow, steady and sustainable is the safest way to do it.
Typically, James, what does it cost to lose weight with Slimbr Health when we compare it to competitors? Why should someone choose it?
Typically, you come under the support from Slimbr doctors, and we issue you prescriptions month to month and offer you medical advice on how to lose weight in line with your calorie guidance. And the total cost for this, including your medication, is around $320 per month, but it depends on your weight loss journey. For example, if we think it will take you 6 months to a year to lose weight or to reach a target BMI, then we can structure a package for you that will enable you to, save money over that time. So by paying up front, you'll lock in a cheaper rate. So it can be as low as €240 per month, including medication delivered to your door. There are many competitors out there. It's quite a competitive landscape. There are many from the UK as well, are selling into Ireland. But, sometimes the cheapest isn't always the best. Doctors will be overseeing you, guiding you every step of the way, and giving you access to Slimbr.com will really help you lose that weight in a sustainable way. You're not left on your own. We're Irish registered and operated here.